Dr. Chesney, thank you for being here with us today to go over the components of your Tick Preparedness Kit. If you would, we would love to hear about what you chose to put in your Tick Preparedness Kit and why.
It's great to be here. Thanks for having me. I would love to review the Tick Preparedness Kit. So I outline everything about this kit in my book, Preventing Lyme and Other Tick-Borne Diseases. So you can read in detail about it there. But let's go through what the contents are today. So first we have Tick Twister, which I'm going to show you here. It's in the bag. These are my favorite tools. I've used tweezers. I used tweezers for a couple of years trying to get ticks out from people. It was so difficult, and I've heard horror stories from my patients. So I came across this. It's called Tom, the Tick Twister. So this is what the box looks like. They're actually in France, and they've got a great technology. I love the Tick Twister. If you had a tick, you would just put this right under and then twist up. And it comes out, the mouth parts come out pretty easily. So I've gotten great responses from patients using them, and I use it in my office all the time. And then we've got a little bag to put that tick right into. So you can save the tick. You can use the pictures in my book to identify the tick, which helps us know which pathogens they're carrying or they could be carrying. So then you can watch out for symptoms of the diseases caused by those pathogens. And then you can send this tick out to get tested. That also helps because sometimes the tick might not be carrying anything, which is such a relief. But then if it is carrying something, it can help you prepare yourself for the next options, as well as looking for symptoms of those diseases. So I love tickreport.com as well as ticknology.org as two excellent options for tick testing. So next, what are we going to do? So we've removed the tick, we've put the tick in the bag, and now you have this bite wound. Then after a tick bite, you would want to place Andrographis tincture onto the bite wound. So I have this tincture from Lyme Core. Andrographis is an excellent herb to use to treat Lyme, but also to use on the tick bite, because when a tick attaches, they release feces onto your skin that can contain pathogens like the Borrelia burgdorferi that causes Lyme. And so putting this Andrographis on that bite wound in the skin nearby could help prevent further infection. I also get reports that tick bites seem to heal better and be less itchy when people use the Andrographis. So it's been really great using this. So we've got our Andrographis, we've got our Tick Twister, we've got our bag, and then what's the next step is that you can take homeopathics. So in our little first aid kit here, we've got Litum. So that's a homeopathic that you can use. Now this does not replace a complete comprehensive treatment that may need to happen if you have an acute tick-borne disease. However, it is an excellent choice to use in the beginning. If you have this at home before you can call your medical provider, get this going. It's 3 pellets under your tongue 3 times a day for 3 days, and that's to treat the bite itself. It helps your immune system get going in a good direction regarding dealing with possible pathogens. Now, if you had some redness or some swelling around the tick bite, that's where we have Apis. So that's another homeopathic, and that will treat some redness, swelling, hot to touch type of a tick bite. Again, it doesn't replace proper treatment. You should be looking out for a Lyme rash, which could be a bullseye, could be a circular, oval type solid rash around the bite. And if you do find that, you would need to certainly reach out to your medical provider for further treatment. But if you had a tick bite, you could add that Litum. If you have a tick bite that is red, hot, or swollen, you could do Litum and the Apis in order to get some acute attention to that bite. And so the last ingredient is the Deer Tick Bite formula. And so this formula can be used as a prophylaxis after the tick bite. I recommend 1 teaspoon 3 times a day on an empty stomach for 30 days for an adult. and that can help with killing the pathogens that may be transmitted from a tick bite, as well as helping your immune system and supporting your neurological system, your heart, your liver, your spleen. Just, wonderful herbs that can support you during that month's time. And during that month's time, I recommend that you watch for symptoms. So in the book, I discuss all of the symptoms of all of the tick-borne diseases that a deer tick can carry. So it would be important to look out for that during that 30-day period. And if you do notice Lyme rash or any of these symptoms like flu-like symptoms, fever, new joint or muscle pain, new headaches, please do reach out to your medical provider because you may need additional treatment in addition to what you've already done to support your body after a tick bite.
When you talk about additional treatment, what are you referring to?
So in acute Lyme disease, I will recommend doxycycline or cefuroxime, and we would just add that to the deer tick bite formula. I also recommend serapeptase, which breaks through biofilm, and we know that Lyme and other pathogens create biofilm around them, and this is one of the ways that they hide in the body.
In your tick preparedness kit, how many days will a 4-ounce tincture get you through?
Right, great question. So this will get you through a week. So it's a really great kit to have to get you started. And then if you have started this deer tick bite formula, you could always order an 8-ounce bottle. Probably you'll need 2 8-ounce bottles to get you through the end of the 30 days.